It was a long time ago, around 20 years maybe. It was 2003, 2004. I just finished my residency in neurosurgery, and at that time I was working in Milan at the Istituto Neurologico Carlo Besta, where I most focus on functional neurosurgery. So I did many surgeries also on brain tumors, and was the time in which they start doing functional imaging, functional MRI, other kind of study that may be closer to the idea of the brain as a function. At that time, eminent epileptologists were there. If I remember well, one was Giuliana Vanzini, the other was Roberto Spreafico. That inspired me in terms of epilepsy surgery. They allow me to meet people of Niguarda Hospital, the Bunari Center, that is quite well known. And I start as a young neurosurgeon to attend their meeting. And I was impressed by the discussion, the vision, all these kind of things. And then my deep interest in epilepsy, particularly epilepsy surgery, started. I went to Cleveland for a couple of months, where I had the opportunity to attend the classes of Hans Luders and Imad Najim. At the time, William Binkman was the surgeon. So in all this first time of my epilepsy surgery career, I have the opportunity to meet many important people. The last one, if there is last one, the last was that trained me well was Olivier Delalande in 2011. I was trained by 11 and 13 on disconnection. That is very important technique in epilepsy surgery in children. And I'm thankful to Olivier because now I'm able to manage this kind of complex surgeries. So this is more or less in few words, what is my history and the reason why. So if, as usual, it's happened when you meet people that you like, and then something special happen. I worked for many years in Italy. Now I'm working in Spain, but if I compare the two countries, I see that the problem or the discussion is always the same. And that point is discussed also in all Europe and all Western countries. That is epilepsy surgery a good option? Are the patients eligible for surgery treated? I mean, their number is the same that we expect as an epilepsy surgeon or epilepsy surgery group. The answer is not, because the number is quite small, and the reason many times is the fear of surgery. So they open the skull, this concept that I can understand make people particularly scared. But this point, this fear is also of the clinician. So it is important to know, to tell, to communicate what is the meaning of epilepsy surgery. And for this reason, we did between 2008 and 2023 in the Epilepsy Surgery Committee of the Italian chapter of ELAI, a dissemination program that allow to disseminate the concept of epilepsy surgery, the meaning of it, how putting a specific session into the Congress, doing workshop, webinar, many meetings at different levels in order to make people aware about the meaning of epilepsy surgery. And that is important, not to change his mind, but to know, and then to do some your own process in order to consider epilepsy surgery or not. At the moment, the less invasiveness of surgery is quite important to change the mind of the clinician, and also the rate of risk of the deficit, postoperative deficit, is absolutely small when you do and plan a good surgery. I am a clinician, neurosurgeon. I'm not a researcher, so my first point is innovation. So how to develop epilepsy surgery according to the neurosurgical perspective. So I think that it's mandatory. The data that the surgeon collects during the multidisciplinary meeting, because by this meeting you can collect many data and then you can plan a good surgery. So surgical planning is the innovation at the moment in this field. Why? Because you get this data, but also there is the availability of 3D models that allow the surgeon to analyze very well the anatomy of the brain and the details of your surgery. The technology helps the surgeon with the augmented reality and the virtual reality. So the surgeon before the surgery can stay within a digital environment that allow him to know all the details and be prepared for surgery. So when you are in an operating field, that the real one, you have so many data that drive you for a better surgery. Moreover, the clinician and the epilepsy community has to know that at the moment, the invasiveness of surgery is smaller than the past. In fact, the surgical approaches are smaller, and new technology is available. One is the laser ablation, and the other that is an old technique, but they are renewing it, that is neuromodulation by a closed loop system that uses biomarkers of the brain in order to manage to treat better the epilepsy of this patient, is very helpful for the development of one part of epilepsy surgery, that is palliative surgery. So by neuromodulation now, we are selecting different targets of the basal ganglia of a specific structure, related to the specific aspect of that patient. So we are applying the concept of precision medicine that is particularly important in epilepsy surgery. The idea of cornetome is a new, it has at least 10 years, but it changed completely the vision of the brain of the epilepsy network as a system that you have to deal with and that change after surgery. So the contribution that the surgeon can provide to the multidisciplinary group is their surgical skills, but also its technology knowledge that can be used very well into the OR and outside the operating room.